Uh, Good afternoon, one and all here. I'm Dr. Kshama, and I'll be presenting, as already said, agreement and precision of anterior corneal power measurements obtained using 3 different instruments. Uh, the slide is here. I'll be discussing the study under the following headings. As we all know, an anterior segment surgeon has numerous diagnostic instruments available in the market for measuring corneal power. These instruments vary in terms of cost, accuracy, and ease of operating. Accuracy and precision is of utmost importance in cases of lens fitting, refractive, and refractive cataract surgeries. Hence, there is a pressing need for studies that assess the agreement among the different devices of anterior corneal power measurements, and such a literature would facilitate in informed clinical decision making. This study evaluates agreement of k-mean values, J0 astigmatic vector, J45 astigmatic vectors between 3 different instruments, that is AK, Topcon KR800, Tommy OA2000 optical biometer, and Sirius oculizer tomographer. Also, we assessed intra-observer repeatability and inter-observer reproducibility. The materials of this study, it was a cross-sectional study with 232 eyes assessed, and patients with good vision with BCVA 6.6, good fixation and above 18 years of age were considered, and those patients having any active ocular surface pathology were excluded. Patients attending our OPD after refraction, after registration history, vision, refraction and NCT is recorded. An anterior segment surgeon sees the anterior segment, an assigned doctor sees the anterior segment, and those fulfilling the criteria are included in the study. After taking the consent, K1, K2, flat and steep axis were taken from each KR800, OA2000 and Sirius oculizer in the same order. And before each reading, patient was asked to blink. And then the readings were taken down and entered in the Excel sheet for analysis. The result of this study can be understood in 3 parts. One is the first is the agreement of k-mean values J0 and J45 vectors. In our study, the k-mean values were interchangeable and were agreement amongst all 3 instruments. This was assessed using a Pearson's correlation coefficient. The value was being closer to 1 indicates agreement, and agreement of J0 values was not seen for both observer 1 and 2, and also J45 vectors were not agreeable. This indicates that the flat and steep axis obtained from the 3 devices are not interchangeable. Coming to the second part, intra-observer repeatability. Very high intra-observer repeatability was seen for K values, but not for J0 and J45 vectors. But this low repeatability was not significant. All 3 devices, 1 or 3 readings are sufficient because of good repeatability. The third part of the result is inter-observer repeatability, reproducibility. Significantly low inter-observer reproducibility was seen for all the 3 devices and for all the 3 values, that is K-mean, J0 and J45 vectors. This indicated that there has to be a surgeon has to rely on a single trained person to take the readings. In short, our study showed good agreement of k-mean values and intra-observer repeatability among 3 devices, and disagreement of J0 and J45 vectors was seen, and there was a significantly low reproducibility. There were other studies where they had one such study by Kinmai Wang et al. They had compared 8 different devices which included KR800 and Sirius oculizer, but they had not included OA2000. Their conclusion was that the K-flat and K-steep values between KR800 and Sirius oculizer was not agreeable, and they didn't assess the interchangeability of J0 and J45 vectors. Another study by Chen S. et al., where they compared Pentacam AXL and OA2000, the values were not in agreement, and repeatability and reproducibility was good for Pentacam AXL. Similarly, there are many studies, but they haven't assessed the astigmatic vectors, or they have not included OA2000 and Sirius in the same study. Concluding my presentation by saying that these 3 instruments can be used interchangeably for k-mean values, but not for J0 and J45 vectors. 1 or 3 readings are enough and no need to take multiple readings, and reliance must be on one trained person for taking reading from a particular instrument. These are my references. Thank you.
Thank you, Dr. Namrata. Dr.